welcome back, everyone, to Your Comments Matters. I'm your host, Carol Love, and we're still talking about the Medicaid crisis facing America today. Well, our show today is coming from Forbes Breaking News from their YouTube channel, and the title of this video is called Devastating. Herb Conoway warns of Medicaid cut impacts on the strained rural communities. And as we've been seeing over the weeks, over the days, that all of these shows that we've been doing, and everyone is saying who's going to be hit first are the rural communities. And I live in a rural community. So this is just the beginning of the year. And if it hits us, if it hits our hospital, rest assured, I will let you know. All right. So today's show, they got 68 views. I mean, Forbes Breaking News. You would think Forbes would have had 68 million. Okay. But that being said, but anyway, those 68 views, someone had to make a comment, right? And so we found three commenters that you may find agreeable today, or you may disagree with them. One of our commenters is going to be Mike Morgan. Then we have Pep Peepstein, and then we have Mark Bogardus. All right. So if you're watching today, thank you so much, because your comment matters. All right, everyone, let's get into the video and let's see what these comments are reflecting on with the news about this Medicaid crisis that we're facing. All right, let's get into the video.
Thank you very much, Representative King-Hines. The chair now recognizes Dr. Conoway for 5 minutes for any questions you may have.
Thank you, Madam Chair, and thank you, ladies, for your service and your commitment to veterans and their health care. I want to make a few comments and observations since both sitting on this committee and what I've heard today. I hope there is consensus on this committee and across the House, across the government, that we need to have a strong VA healthcare system, and that we need community providers.
Our veterans deserve
it.
It
doesn't exist everywhere, particularly in rural areas. And so we know that this partnership needs to exist. One of the problems, as a physician, practicing physician for 30 years myself, worked on an Air Force base in New Jersey taking care of veterans and in the community and private practice. What my experience tells me, and what I have read about, and what the research shows, and what we all know with the problems with our information system, is that there's not coordination across those systems. Once you move outside of a system, even within hospitals in my own little state of New Jersey, getting records to move from hospital to hospital, if they're not on the same platform, is a very difficult thing to achieve. And you will have, and so you're going to have patients, if they move to different locales, having to repeat their stories, and it's terrible when it involves things like trauma. When you're in a teaching institution, your resident might see you, might be a medical student, then a resident, then the attending. And so this is part of the teaching process in teaching institutions, and unfortunately, we will hear stories about people being re-traumatized as this information is collected. But that iterative process in teaching institutions is part of driving great outcomes. I would also say that we have to rely on data, as you mentioned, and the data has been consistent over many years and repeated that VA care for veterans provides great outcomes. Veterans want care there.
Yes.
And if you think a moment about the different exposures, the experience in the military where they have been, the experience of people taking care of numbers of veterans over years that is unlikely to be replicated in most communities, it doesn't surprise me that outcomes are better than the VA system. Our problem is that it's hard, maybe I should speak for myself, but I think I'm speaking for a lot of others too. When we understand that the administration is cutting tens of thousands of people out of a system that's already stressed.
Yes.
It's hard to imagine that you can achieve the kind of outcome standards that you could achieve if those people weren't out of the system. Now, reform, looking at how things are done, making sure training is correct, maybe having a special access for women who are having particular problems, whether it be reproductive health care or sexual trauma in the service. Those things are important to put in a system. I think you're more likely to get that in the VA than very often you're in the community, by the way, because of the sensitivities in the VA system for this. I suspect, and as I look at the numbers we have about the people who have been, who are leaving the service now, as I look at the numbers, 2/3 of them are clinical staff, physicians, nurses, support staff. And so if we were to decide to bring in or try to recruit more women to deal with sexual trauma in the service, I can't imagine how that wouldn't be decried as a DEI program within the government. You can't even recognize women who've served honorably overseas because it's, recognizing women, and never mind people of color. So I want to ask this question of you, Ms. Newman, because you work in a rural area, and we know now that there are a number of studies that are coming out showing that these Medicaid cuts are going to be particularly devastating in rural areas where Medicaid might make up 40 to 50% of their revenue. We heard 338 hospitals at risk. You live, and others on this panel live and get care in rural areas. Can you describe how the loss of hospitals in the community is going to impact access to care, the access that we know veterans need?
Thank you for the question. Yes, I do live in a rural area. In my particular area, we already have lost access to hospitals.
Wow.
We are an independent home care agency, and these cuts are not going to, in particular, impact our agency. But our people in our area, they're already used to traveling to receive care.
Just reclaiming my time because I'm running out of time. And thank you for that. I think it is it's obvious that if hospitals close, there's going to be an access to care problem. I asked Secretary Collins at a hearing just like this one about whether or not cuts to Medicare and food assistance is going to impact veterans. He says, I don't foresee that happening. Now it's happened. And we know, as a result of that big ugly bill, that we're going to see really quite devastating dislocation.
All right, everyone. Well, there is the video. You saw it for yourself right there from Forbes Breaking News. This was a subcommittee right there in Congress where they're taking up this issue. And this was Dr. Conoway as he was speaking. So he was saying that we need a strong health care for the VA. Our veterans need it, y'all. All that they've done for this country, for our nation, to protect us, they should have the top-notch health care. Amen. So they really should be getting the best service. But, it's difficult for the veterans to get the help that they need. And that's sad. It's really sad. So he was also saying that the VA care provides a great outcome, that we need to have a great outcome in a stress situation. We're stressed right now. Now they're talking about to take away more cuts. They want to take away more programs. It's already stressed. We need to see how we can strengthen the program, not make it fall apart. Okay. So he was saying that Medicaid in the rural areas are going to be devastated. They're expecting like 300 plus hospitals that will be closing. And especially a lot of these home care workers, like that lady described, how you have in the rural areas, they don't have access to a hospital that's close. So they need people to come out and help them with services, with the care and stuff. Well, if you cut the Medicaid back, the lady said that they can't go out there in the rural areas and to help the poor anymore. So it will be devastating. All right, then, everyone. So the last comment that he said, he had asked Secretary Collins, he said, what's your opinion about these Medicaid cuts? Talking about, it won't affect the veterans. Oh, well, he said, well, we're seeing it is affecting the veterans. That's why I have the committee on right now. So there it is right there, everyone. You saw the video. Let's get into the comments and see what you have to say about these Medicaid cuts, especially when it hits our veterans. Okay, let's take a look. Here is our first commenter, and this one is coming from Mike Morgan, 8588. Hello there, Mike Morgan, and welcome to Your Comment Matters. Requiring able-bodied people to work part-time or do volunteer hours isn't a travesty. It's humorous to watch these overreactions. So here is the comment. Mike got 2 thumbs up on that. See, able-bodied people, yes, you need to go to work. But if you're an able-bodied person that's taking care of your disabled family member, you can't go to work. You can't go to work or volunteer or any of those work requirements that they talked about, because you need to be home to take care of the disabled person, that family member in your life. And so, but if you are able-bodied and you sitting around and you, like they say, playing games all day, you doing nothing, you can work. Yeah, you should go to work. Now, you should go to work. Ain't nothing wrong with you. Ain't nothing wrong with you. You should go to work. You're able-bodied. Yes, you are. You're able-bodied to get a job. So I agree with you on that. So, but we're seeing that it's the disabled people that's being affected, excuse me, with these cuts that's coming forward. Let's take a look at our next commenter. Peppy Epstein says, Peppy, you might want to change your last name, Epstein. You know, that's a trigger word. Okay. Peppy says, so if the system is stressed, wouldn't getting rid of the scammers and illegals make it easier for those who really need to get it questioned? Yes, it would. That's the whole plan. That's the whole game. But we're seeing that that's not what's happening. They're getting rid of American citizens. They're cutting back American citizens that are needing this care with disabled family members and stuff, or disabled themselves. So yes, everyone agree, you know, that's the whole point, to get rid of the scammers and the illegals. Yes, go in and get rid of them. But don't in the meantime throw the baby out as well, you know, those that really need it. So great comment. You got 4 thumbs up on that comment, Pepe Epstein. All right, then let's take a look. I don't know who this from. This is from someone in China, Japan, or something. But they say, how exactly was the Cuban annuity first communicated to you as a payee? Don't know what you're talking about. Next comment. Y'all gonna get this one with Mark. Mark says, legalize pot. Let the states run the growing and dispensing of it. If all proceeds go 100% to that state's Medicaid system, they would never have a problem. Mark Bogartis, you know you being funny. You know you being comical. But you know that's what they do with the lottery, right? They tell us, buy the lottery ticket, and it's going to help the school. Well, Mark is saying, get the pot, legalize the pot, and that'll help pay for the Medicaid. That'll help pay for the Medicaid system. Okay, well, you know they got the gummy bears and all these cookies and all that other stuff out there, y'all. Y'all know how they got the cream and the pills. They got that pot in pretty much anything that you have out there. And they said, "Ooh, I took it, and girl, I felt good." Let that pay for the Medicaid system. All right. Okay, everyone. Hey, listen, thank you all for your comments here on today. I hope you that are watching the show today, your comments matter. So make your comments known below right here on our YouTube channel. But we want to give a shout out again to Mike Morgan, Peppy Epstein, don't know who the Asian person was, and Mark Bogartis. Thank you all, because your comments matters. And again, audience, do you agree with them or you don't? Let us know again. All right. Well, that's going to do it for us here at Your Comments Matters. And I will see you on the next video. Thank you all for watching, liking, commenting, sharing, and subscribing to Your Comments Matters. See you on the next video. Take care.